Chapter 8, Venipuncture Procedures. Please take a moment to review the objectives of this chapter. So, this whole process is probably the most important part, or part of the job that you're going to do the most. So this is the venipuncture process, the process of collecting or drawing blood from a vein. This is what's covered in this chapter. These are the venipuncture steps. I could read each one of these to you, but I'm not going to. Just make sure you're familiar with them, and I promise you will become familiar with all of these steps as you practice on each other and patients. I'm going to just mention a few important parts of these steps. You need to review an accession test request. You must be able to check to see that all required info is present and complete. Verify tests to be collected and time and date of collection. Obviously, you want to be able to know what you're drawing for and what you need to draw. You also need to be conscious of time and date of collection. Approach, identify, and prepare the patient. Always make sure you identify the patient, identify yourself to the patient, obtain consent for the procedure, and use professional bedside manner. Patient identification. You need to verify the name and date of birth, check ID bracelet, and the other following steps mentioned here. As far as preparing the patient goes, you need to explain the procedure and address any patient inquiries. Remember, the patient is involved in their own health care. They should never feel like they don't know what's going on. It is important to make sure to be aware if a patient has a latex sensitivity, as the gloves you use may have latex in them. And of course, sanitize your hands. Positioning a patient. Inpatients usually are lying down in the bed. Outpatients are usually in a blood drawing chair. Then there's some special considerations for patients prone to fainting. Alright, so you're going to apply your tourniquet snugly 3 to 4 inches above the intended site. Never apply to an over an open sore, and ask the patient to make a fist. The preferred site for drawing is the antecubital area of the arm. The median cubital and median veins are the first choices. Roll your fingers side to side while pressing against vein to judge its size. Avoid veins that feel hard and cord-like or lack resilience. Clean and dry the air site. Clean the site with an antiseptic to avoid infection or contamination using the 70% isopropyl alcohol pads. You need to move outward in widening concentric circles. Allow area to dry 30 seconds to a minute. Do not blow on the site. Don't touch the site after you clean it. If you do touch it to find the vein again, you just need to clean it again. You need to have your equipment in an area that you will be able to access it once you have punctured the patient's vein. And you, of course, need to put on your gloves. Okay, you need to anchor the vein and insert the needle. Using your non-dominant hand to anchor, secure firmly the vein. Place them at least 1 to 2 inches below and slightly to the side of site. Pull skin down towards the wrist. All of these things, again, you'll be more familiar with when you actually see them being done. You need to go in with the bevel facing up, position needle above the insertion site, insert at a 30-degree angle or less in smooth, steady forward motion. Once you have established the blood flow, you can release the tourniquet and ask the patient to open their fist. Always keep in mind the order of draw. Place the gauze, remove the needle, and activate your safety feature on your needle and apply pressure. Discard of all needles in a sharps container. Alright, you always need to make sure you label the tubes. Patient with the patient's first and last name, patient's identification or medical record number, or date of birth. Always put the date of time of collection and your initials. Some specimens require special handling instructions. Most of the time, if that's required, either you'll already know it or there'll be instructions at the draw. Always make sure you thank a patient and sanitize your hands. Pediatric venipuncture. This is for children under the age of 2. Limit to superficial veins. Challenges, of course, they will have small undeveloped veins. Dealing with the child, it's important that you gain their trust, approach slowly, and notice the level of anxiety. Explain the procedure in terms a child can understand, and emphasize the importance of remaining still. Alright, in instances where you need to use restraint, in infants, toddlers, you're going to wrap infants in a blanket. Toddlers you can have the parent hold on their lap. Equipment selection, butterfly needles usually for small kids. Geriatric venipunctures, these are some of the challenges, and you're going to be sticking a lot of geriatric patients. Blood collection procedures, again, patient identification is the most important thing. Site selection, you want to avoid bruised areas from previous venipunctures. When it comes to dialysis patients, do not use the arm with the AV fistula for venipuncture. And the rest of these are just some techniques to use with specific patient populations.